The intestinal fluke, specifically Fasciolopsis buski, was first discovered in 1843 by the German physician Heinrich Friedrich Adolf Busk. He identified this parasitic flatworm in the intestines of humans during a post-mortem examination. Fasciolopsis buski is one of the largest trematodes, flukes, that can infect humans, commonly found in parts of Asia, and is known to cause significant gastrointestinal ailments. The discovery of this fluke was important in understanding the range of parasitic diseases affecting humans, especially in regions with specific dietary and environmental factors that facilitate the life cycle of these parasites. The infection route of intestinal flukes, particularly Fasciolopsis buski, is a complex process that is closely linked to specific environmental conditions and human behaviors. It begins with the release of fluke eggs into freshwater sources through human feces. These eggs hatch into larvae, which then seek out and infect a suitable freshwater snail. Within this intermediate host, the larvae undergo several developmental stages and transform into a new larval form known as cercariae. After maturing, these cercariae are released into the water and subsequently encyst as metacercariae on aquatic plants. The key point of transmission to humans occurs when these contaminated plants, often water chestnuts, bamboo shoots, or watercress, are consumed raw or undercooked. Once ingested, the metacercariae make their way to the duodenum, where they exist and attach to the lining of the small intestine. Here, they mature into adult flukes. As adults, these flukes reside in the human intestine and commence the production of eggs, thereby completing their life cycle. These eggs are then excreted through human feces, returning to the freshwater environment and allowing the cycle to continue. This infection route underscores the significance of environmental hygiene and proper food preparation, particularly in areas where the consumption of raw aquatic plants is common. Thorough cooking of these plants is a critical step in preventing infection. Intestinal fluke infections, such as those caused by Fasciolopsis buski, lead to a range of symptoms that can vary in severity based on the intensity of the infection. Commonly, individuals infected with intestinal flukes experience abdominal pain or discomfort, particularly in the upper abdomen. This is often accompanied by gastrointestinal disturbances like diarrhea, which can be chronic and severe, and in some cases, dysentery characterized by blood and mucus in the stool. Nausea and vomiting are also typical symptoms, and they may be especially noticeable after eating. These gastrointestinal issues often result in a loss of appetite, which, if prolonged, can lead to significant weight loss and various nutritional deficiencies due to the parasites absorbing nutrients from the host's diet. In severe cases of heavy infestation, intestinal obstruction can occur, causing acute abdominal pain and other related complications. Alongside these symptoms, individuals might experience general weakness and fatigue, which are common in many parasitic infections. Chronic infection can also lead to anemia, a condition characterized by a deficiency of healthy red blood cells. Additionally, in some instances, particularly in children, there can be edema, where fluid retention leads to swelling, often noticeable in the face and abdomen. Fever may also be present, although it is less common and typically associated with secondary complications of the infection. The severity and combination of these symptoms can vary widely among individuals. Some with light infections might show no symptoms or only mild ones, while those with more severe infections are likely to experience a range of more intense and debilitating symptoms. Proper diagnosis and treatment by healthcare professionals are crucial for effectively managing and resolving the infection. Treating intestinal fluke infections, such as those caused by Fasciolopsis buski, primarily involves the administration of antiparasitic medication, with praziquantel being the most commonly used drug. This medication is effective in killing the adult flukes present in the intestine, and the specific dosage and treatment duration are tailored to the severity of the infection and the patient's health condition. In addition to antiparasitic therapy, supportive care plays a crucial role, particularly in severe cases of infection. This may include rehydration therapy for patients experiencing significant diarrhea, as well as dietary management to address any nutritional deficiencies that have arisen due to the infection. Monitoring and follow-up care are also important aspects of treatment. After the completion of the initial course of medication, stool examinations are often conducted to ensure that the infection has been fully cleared. In some instances, a second course of medication might be necessary if the infection persists. Preventing reinfection is another critical component of managing intestinal fluke infections. This involves educating patients about proper food handling and preparation, especially in regions where consuming raw aquatic plants is common. Ensuring that these potential sources of infection are cooked thoroughly is a key preventive step. In areas where intestinal fluke infections are endemic, broader public health measures might be needed. These can include improving sanitation and sewage systems, providing access to safe drinking water, and conducting community health education campaigns. For patients who have suffered significant weight loss or nutritional deficiencies due to the infection, a program of nutritional rehabilitation may be required. This program would typically involve dietary supplements and a diet plan designed to meet the recovery needs of the patient. It's essential for individuals experiencing symptoms indicative of an intestinal fluke infection to seek medical attention for accurate diagnosis and appropriate treatment. Self-medication is discouraged due to the necessity of correct diagnosis and a specific treatment regimen.